Thank you so much for joining me this morning to hear a little bit about Dementia Care Specialists throughout Wisconsin, what we do, our role, and our services. My name is Candace LeGros. I work for Milwaukee County Department on Aging, and I am one of their Dementia Care Specialists. Okay. The first thing I would like to talk about is the DCS role throughout the state. So currently we have 33 DCSs throughout the entire state of Wisconsin. We serve actually 34 aging and disability resource centers. That covers about 56 counties throughout the entire state of Wisconsin, as well as 5 tribes that we have. We actually have DCSs that serve specific tribes throughout the state of Wisconsin. So the first thing I want to talk about is what is a dementia care specialist? What do we do and what services do we provide to community members? First off, like I said, the dementia care specialists are all embedded in aging and disability resource centers, and we actually have three main goals to our job. So the first one is to support the aging and disability resource staff to better be prepared and understand, like acknowledging resources surrounding dementia so that they can also support the people they serve, families that they serve that might have someone that they're caring for who has dementia. We also act as a catalyst to create dementia-friendly communities so that we have businesses, employees, local organizations that are more dementia-friendly so that people who are living in that community feel more included into their community because their community is a little bit more dementia-friendly. Lastly, and most importantly, we assist individuals who are living in our community with dementia, as well as helping their caregivers so that they can remain in their homes for as long as they can, and that their caregivers feel supported. They feel like they have the knowledge and the resources to continue to caregive for their loved one who has dementia. Next, I would like to talk about, so how do you get connected to us? So how do you get connected to the DCSs within Milwaukee County? So there are a few different ways. So first off, you can just call our main number. You can leave us a message and we will call you back. Our direct line is 414-289-6259. You can also send us an email. Our email is dcs@milwaukeecountywi.gov. And you can also go ahead and you can visit the Milwaukee County Department on Aging website. There's a tab on the top that says dementia. You click on that, and if you scroll down a little bit, it says connect with a specialist. If you just go ahead and click on that, you can actually fill out our online DCS referral form. It'll come right to us, and we will connect with you from there. So that's how you can get connected to Milwaukee County DCSs. But what can we do? So there are many things and types of services that we can provide. So if someone is looking for a memory screen that's not really interested in going into a long-term care program, that is 100% fine. We are offering memory screens virtually or over the phone right now. Also, if someone is just having some concerns about their memory, they just aren't sure if it's a normal part of aging or if it's not a normal part of aging, and they just want to talk more about their concerns, they can absolutely connect with us and we can talk to them a little bit more about brain health and normal versus not normal aging. If someone is looking for dementia-specific education or assistance, they can absolutely make a referral to us. If they want some assistance with advanced care planning for someone, if they're caregiving for someone with dementia and they just kind of want to make a good, backup plan or thinking ahead, we absolutely can help with that. Connecting to maybe a support group or other community resources. If someone is looking for dementia-specific, caregiver education or support. And then lastly, we also provide dementia-friendly business training and do lots of educational presentations as well. So they can absolutely connect to us for that. The next thing I want to talk about is just some dementia care specialist referral examples. So the first one I'd like to go over is a consumer, contacts us because she expresses that she has been, caring for her husband with Alzheimer's disease for the past 3 years and she's getting a little burnt out. She says she would like some help, but really isn't sure what kind of help is available or even where to start. So she's like, I need some help. I'm just not sure where to begin. We talk with her, we fill out a dementia care specialist referral form online, and then we connect with her. We do what we call a DCS consultation just to kind of find out some more background information, so we can get her connected to the resources that would help her and also a form of all the resources that would be available to her. So that's the first referral example. The next one is a consumer and a consumer spouse attend a Let's Talk Brain Health presentation provided by the DCS. Consumer's spouse calls us because they said they learned more about that not normal parts of aging, and that they think that his spouse is displaying some early warning signs that they learned about during our presentation. So I talked with them a little bit, and we actually conduct a memory screen, and we did find signs of memory loss. So I worked with the husband and his wife to get them into a memory diagnostic clinic just for further evaluation to determine what exactly is causing that memory loss. So that's kind of that second example, getting them connected to that service that they were specifically looking for. Okay. Lastly, I just want to talk about when to not make a DCS referral. So DCSs actually don't handle any type of, crisis type of situation. So if it's like an emergency, you need help right now, DCSs are not the right person to call for that, so no crisis situations. If somebody is actually living in a facility, Dementia Care Specialists only work with community members. So we work with people who aren't living in a facility. We only work with people in the community because that's one of our goals, is to keep people, living in the community independently supported for as long as we can. So we don't work with people who are living in a facility. And also anyone who is in a managed care organization. So if you're in a long-term care program already, we actually refer them back to the dementia lead within their organization. So if they contact us, that's okay. We will loop them back and connect them to that dementia lead so they can still get the support and services that they require. Okay, and lastly, like I said, we are housed in the Aging and Disability Resource Center, so you can also get to us just by calling the main intake line, which is 414-289-6874. You can visit our website, you can email us, so we're just one click or a call away, so you can always reach out to us for any, caregiver education, advice, resources, anything like that. I'm just going to go ahead and see if we have any questions that came up down on the stream. Okay, it doesn't look like I have any questions at all, so thank you so much for joining me this morning. I hope you learned a little bit more about what dementia care specialists do, and I would like to thank SOA for inviting me to do this live stream today. It was very exciting, my first one, so thank you very much. You can again reach out to us anytime if you have any questions or want to connect with the DCS. So have a very wonderful day, and thank you for joining me.